Neurographica, a workshop for therapists navigating countertransference.
Welcome to my YouTube channel. I am excited to have you here, a space where we delve into expressive art therapy interventions and transformative practices. For those of you who do not know me already, my name is Sara, and I am pursuing a Master of Arts in Counseling Psychology with a concentration in expressive arts therapy at the California Institute of Integral Studies. As a multi-certified integrative transformation coach, I curate group and one-on-one programs to support clients worldwide. My certifications include being an advanced family and systemic constellations facilitator, a certified strategic intervention life coach through the Robbins Madonnas training, a Deepak Chopra primordial sound meditation instructor and Ayurveda instructor, as well as a well-being life coach. I am also certified in health coaching from the Institute of Integrative Nutrition. I have over 10 certifications in Neurographica training and various other qualifications. For a full list of my credentials, I invite you to visit my website, which is linked below this video. Before starting my graduate studies, I earned a Bachelor of Arts in World Arts and Cultures from UCLA with a concentration in dance, and an Associate of Applied Science degree in Fashion Design from the Fashion Institute of Technology, as well as Polymoda, an internationally acclaimed design school in Florence, Italy. Professionally, I have been a dancer, performer, fashion designer, and stylist. And as a coach and therapist in training, my approach is integrative, trauma-informed, and client-centered, drawing from a wide array of theoretical influences. I am particularly interested in postmodern movements like strength-based therapy, feminist theory, multicultural counseling, solution-focused therapy, narrative therapy, expressive arts therapy, and mindfulness approaches. Additionally, I find value in transpersonal psychology, humanistic approaches, attachment-based therapy, and internal family systems. While this workshop is tailored for therapists addressing countertransference, it is important to note that Neurographica can be applied to various challenges, goal setting, emotional processing, and mindfulness practices. It is accessible to anyone who can use their hands and has access to colored markers or pencil crayons, paper, and pens. So while this presentation focuses on therapists and mental health care providers navigating countertransference, please know that Neurographica's utility is not limited to a specific population or purpose. A disclaimer: numerous testimonials attest to the positive changes in people's lives after using the Neurographica method. However, please note that if you are a mental health care provider experiencing significant countertransference, it is important to understand that Neurographica should not be used as a standalone methodology, nor should it replace supervision or mental health support. It's merely a tool that can complement other methods of addressing professional challenges related to clients and countertransference. What is countertransference? Countertransference is the therapist's emotional or psychological response to a client which may be influenced by the therapist's own unresolved issues, experiences, or biases. It occurs when the therapist's feelings, attitudes, or reactions towards the client are reflective of the therapist's personal challenges rather than solely the client's dynamics. Countertransference can affect the therapeutic relationship and may hinder effective treatment if not recognized and managed appropriately. Over the past several decades, countertransference has undergone numerous definitions and reinterpretation and has evolved into a multifaceted and comprehensive clinical phenomenon. Nowadays, therapists from various theoretical backgrounds generally perceive countertransference as a highly valuable concept.
There are three primary kinds of countertransference. The classical perspective originated from Freudian theory, and it defines countertransference as the therapist's unconscious reaction to the patient's transference. In this view, countertransference is a hindrance to treatment and something to be controlled and managed. In contrast, the totalistic view broadens the scope of countertransference to encompass all emotional reactions, both conscious and unconscious. Essentially, it is everything the therapists bring to the therapeutic setting as a human being. And here, countertransference is viewed as inevitable and partly influenced by the patient's inner world. The complementary view overlaps with the totalistic view and sees countertransference as mirroring the patient's relational style. It emphasizes the therapist's countertransference as a counterpart to the patient's way of relating. Collectively, these perspectives highlight the recognition among clinicians and theorists of the significance of countertransference reactions in fostering and sustaining therapeutic relationships. Countertransference responses can vary significantly in their intensity and duration. Some may involve intense emotions, physical sensations, thoughts, or fantasies. In certain cases, the therapist may feel deeply connected to the experience, while in others, they may feel foreign or irrelevant. Bruscia outlined a framework including 5 key components, which provides a structured approach to understanding and navigating countertransference within the therapeutic relationship. I have listed them here, and feel free to take a look at the PDF attached to this video. The therapist's capacity to attend to their emotions, encompassing awareness, analysis, recognition, and reflection, has enhanced treatment outcomes. Therapists' awareness of their spectrum of emotions is crucial for comprehending the patient and facilitating therapy effectively. Several studies have shown a positive correlation between reported alliance and the utilization of mindfulness practice and self-guided imagery meditations. After reviewing the literature, I believe that utilizing Neurographica may assist mental health care professionals in processing, understanding, and integrating their countertransference. This practice offers a pathway to gain insights, foster reflection, and ultimately contribute to a healthier outcome for therapists and their clients. So what is Neurographica? Dr. Pavel Piskarev, the visionary behind the Psychology of Creativity Institute in Moscow, Russia, founded Neurographica. It is a unique graphic language enabling the creation of an outer manifestation that supports inner transcendence. It is an integrative approach in that it asks the user to engage with their intellect, emotions, and somatic sensations. From a neuroscience perspective, Neurographica activates neuroplasticity by awakening dormant neurons. It is based on the founding principles of several psychological theoretical approaches, as well as neuroscience. So let's begin the workshop. In Neurographica, there are various components such as compositions, graphical shapes, a glossary, and foundational principles. However, for this workshop, we will only focus on the following aspects: the neuroline and its definition, illustrating the neuroline, and how to use the basic foundational composition, the algorithm for removing limitations, otherwise known as ARL. Piskarev refers to the neuroline as the line of freedom, and just like life, it leads you to where you don't expect it. The neuroline reflects the functioning modes and frequencies of the brain. By sketching these states, we align with the diverse frequencies of the brain, allowing us to attune to our brain's optimal rhythm for self-regulation and overcoming challenges. The neuroline connects all the elements in the composition and is the main asset of Neurographica. One fundamental principle in Neurographica is that the quality of the outcome is determined by the quantity of lines utilized. The greater the number of neurolines present, the more activated neural connections become. The neuroline resembles the organic lines in nature. It can be found in the branches of trees, in lightning, the veins of leaves, the rippling of water in desert sand, the cracks in mud or the rings within wood, on a zebra, the patterns in marble, the wrinkles of skin or the contours of a sheet. Neurolines can be seen in broken glass, plants, and in the neural pathways of the brain. Therefore, we can connect with the entire universe and experience the divinity of being through the neuroline. How to illustrate the neuroline? To begin, use a coin and follow it on your page. Relax your hand and allow it to melt into the pen. The magic of drawing a neuroline happens when we relinquish all control and surrender to the tip of the pen. It is important not to try to handle or direct the line. Allow it to go where it desires. When two lines in a drawing cross, they will create sharp angles. And according to Neurographica, intersecting lines indicate a conflict or a problem. Therefore, we must take care to round these, supporting the subconscious mind to feel more harmony, safety, and peace. When lines are conjoined using the rounding principle, new insights are naturally gained. The algorithm for removing limitations, otherwise referred to as ARL, is the basic algorithm and the underlying structure of all Neurographica algorithms. The algorithm consists of 8 steps, and these steps apply to all Neurographica compositions. Directed by the 8 carefully curated steps, the catharsis is equalized and dissolved into the background and surrounded by the environment, resources, divinity, and connections. Step 1. Select your topic. This can be a challenge, desire, intention, sensation, emotion, idea, or goal. In this context, select a topic that has to do with the countertransference that you may be experiencing. It is crucial to restrict yourself to one topic each day to allow neural pathways to expand and new connections to form. Set a timer for 2 minutes and engage in a stream of consciousness writing, allowing words inspired by the chosen topic to emerge. After 2 minutes, count the number of words you've written. There should be 18 or more words to ensure that the neural pathways have been activated. Step 2. The composition. Now we are going to illustrate the catharsis on a blank page. This is an emotional throw, an instinctual scribble to release any emotions activated by the stream of consciousness writing. It gets released onto the paper with very little thought and analytics. Next, the catharsis is equalized and dissolved into the background using neurolines. We extend all of the floating lines of the catharsis towards the edge of the page. This represents you reaching out for support, looking for resources, asking for guidance, reaching to community. Step 3, rounding, conjoining, or harmonizing. During this process, we conjoin and round all the intersections of lines. This technique results in a graphical depiction of neural connections and nodes. In ARL, it's crucial to round every corner and intersection. Angles represent potential complications and conflicts. While not all complications are necessarily negative, in this specific algorithm, however, our aim is to harmonize all of these conflicts to ensure smooth integration. Step 4. Integration. This is where Neurographica transitions into aesthetics. It's important that the user finds their Neurographica drawing visually pleasing. In fact, the more aesthetically pleasing it is, the more effective it tends to be. Next, we introduce color into our illustration, a process referred to as archetyping. Our primary objective is to unify the separate elements of the drawing into a cohesive system. It's important that adjacent shapes are colored similarly to avoid leaving any parts disconnected from the whole, each shape finds companionship and support within the unified system. Just as in life, we are not really alone. We have support, we have resources, and we have divine guidance. And even at times when we do not feel that this is always true, we are telling our brain through the illustration that this is possible. The magic happens when one gets lost in the illustration and connects to the flow state, mindfulness, and meditation of sorts. It is at this point that new neural connections are created and the synapses begin to fire off. Throughout the process, check in with your body's sensations. What are you feeling? Do you have sweaty palms? Does your head feel dizzy? Do you feel cool or hot? What are your thoughts? Are any emotions emerging? Keep a piece of paper close by and write down any reflections or insights that you may receive. Step 5, the field lines. The field lines are representative of the theta waves of the brain, a state of deep relaxation and a meditative or hypnotic state. They are associated with creativity, intuition, and access to subconscious thoughts and memories. They also play a role in emotional processing and problem solving. In Neurographica, the field lines are symbolic of a higher power. Some may call this God, the universe, source, inner wisdom, ancestral energy, or the higher self. It is the belief that there is something greater at play, that we are being divinely guided and supported by. We use a thicker pen to represent the power and support. This line connects from one side of the page to the other. It is infinite and continuous, even if one cannot see it. Be sure to harmonize and round out any edges after you have created your field lines. Step 6, the focus. Find an area in your illustration that draws you in, that compels you. This is your focus. The part of your illustration that feels significant and meaningful to you, even if you're not sure why. In Neurographica, we use a circle as this represents harmony, wholeness, divinity, and peace. This circle represents you. Don't forget to harmonize any sharp angles that may appear once you highlight your focus using a thick pen. You can place the circle any way you want on the page. Step 7, Topic 2.0. This is the wisdom and insights that you may have received during the process. What did you discover about the topic? What answers came to you? This sometimes does not happen the first time the topic is illustrated. If the challenge is deep or unclear, it can take several illustrations to connect to the wisdom. The reflections may also come when you least expect them. Step 8, Stylization. This step was introduced just over a year ago. Piskarev recognized the significance of enabling users to incorporate shading or other aesthetic elements at this juncture in the illustration. As previously mentioned, ensuring the user's satisfaction with their creation is important. This not only fosters neuroplasticity, but also encourages positive reframing and the emergence of resolutions. So as we come to a close, I would like to present you with some discussion questions. Are there any advantages or constraints you perceive with this technique? How would you incorporate other EXA practices into Neurographica? Are you familiar with any other visual art therapy methodologies designed to stimulate neural pathways and foster brain neuroplasticity? So that concludes our workshop. Thank you so much for watching. I look forward to seeing your comments in the discussion board and engaging further. If you have any questions, feel free to reach out to me. You'll find all my information below this video.